including monkeypox and others that our panelist today is going to brief us on. Now, we are also going to be talking about the final onboarding of level 2 partners for the kickoff of the Saving Lives, Saving Livelihoods campaign. You will remember this is a campaign that was launched last year or the year before that. By the then director, Dr. John Kengasong. But today, as usual, we have the acting director of the Africa Centers for Disease Control and Prevention, and he is Dr. Ahmed Ogwell. And very shortly, he's going to be giving us that brief of the situation of pandemics across the continent. But let me just give you and remind you of the contact details for you to send in your questions for when we get to the question and answer section. So you will then send your questions to this number +251 94 550 2310. That's a +251 94 550 2310. But we can also take your questions live on this platform as well as through the question and answer section. Okay, my name is Wayne Musabayana. I'm head of communication at the African Union Commission, and it's a pleasure to be your moderator for today. For now, let me hand you over. I'm going to hand you over to the acting director of the Africa CDC, Dr. Ahmed Ogwell. Ahmed, you have the floor.
Thank you. Thank you very much, Wayne. Good morning, good afternoon, good evening, wherever you're joining us from. And welcome to this week's press briefing. Let me start with the COVID-19 situation here on the continent. As of today, June the 23rd, 2022, all our African Union member states are reporting COVID-19 cases. And so far, we have documented a total of 11,748,237 cases from the beginning of the pandemic. This is about 6% of all the cases that are being reported globally. In terms of recoveries, we have documented 11,120,000 people who have recovered here in Africa from COVID-19. And this accounts for 95% of the cases that we are reporting here on the continent. Unfortunately, we have lost 253,868 people on the continent, which gives us a case fatality rate of 2.2%. These deaths in Africa account for 4.1% of the deaths globally. In terms of the cumulative number of reported cases, 61% are coming from the following 5 African countries. South Africa with 34% of the cases, Morocco with 10%, Tunisia with 9%, Egypt and Libya each with about 4% of the total reported cases from the beginning of this pandemic. The case fatality rate for this week, we are seeing that 39 countries on the continent are reporting a case fatality rate that is higher than the global average of 1.2%. And only 2 countries are still reporting a case fatality rate of more than 5%, and that is Somalia and Sudan. Since the last briefing last week, there are no additional countries that are experiencing either a 3rd wave or a 4th wave. But in as far as the 5th wave is concerned, we are seeing 3 additional member states, and that is Burundi, Ghana, and Mozambique, to give a total of 20 countries that are reporting having experienced a 5th wave. It is instructive to also note that 7 of these countries, which makes up about 35% of the our member states in Africa, have reported a more severe 5th wave. 2 countries, Kenya and Mauritius, are experiencing a 6th wave. In as far as variants of concern go, we do not have a change in the reporting since the last year. It is, however, of note to share that since November of 2021, 24 member states have reported the Omicron BA2 sublineage. When we look at the trend analysis for the past 1 week, that is epidemiological week 24, when we compare it to week 23, we see that we are reporting a total of 34,695 new cases on the continent. And this represents a 19% increase from the previous week. The highest proportion of new cases is coming from the Northern Africa region, with 37% of the reported new cases. The other regions are reporting as follows: Southern region with 26%, Eastern region with 25%, Western region with 10%, and Central region with 2%. The following 5 countries are reporting the highest numbers of new cases: Morocco with 10,386%, South Africa 6,056 cases, Ethiopia 5,175 cases, Tunisia 2,277 cases, and Kenya 2,208 cases. Let me repeat that Morocco is the highest, reporting the highest number of cases during this epidemiological week 24 at 10,386 cases. The following 5 countries in Africa are reporting the highest daily incidence per million population. As we always report, this is the average number of new cases per million population as reported from each country during this period. Seychelles with 313, Cabo Verde with 292, Morocco with 39, Tunisia 27, and Namibia 22. A total of 196 new deaths have been reported during this epi week, compared to 203 from the previous week. And this represents a 3% decrease in the new deaths that have been reported during this week. Let's look at the 4-week trend analysis. During this the last 4 weeks, we are seeing that there has been an overall 6% average decrease in the new cases being reported in Africa. In terms of regions, the breakdown is as follows: 75% increase in the Eastern Africa region, 70% increase in the Northern Africa region, 62% increase in the Western Africa region, 5% increase in the Central Africa region, and 32% decrease in the Southern Africa region. In terms of the most populous countries in Africa, we are seeing that Ethiopia is reporting a 97% average increase during the same 4-week period. Kenya, 84% average increase. Nigeria, 34% increase. DRC, 23% increase. And Egypt, 100% average decrease, while South Africa is showing a 37% average decrease in these 4 weeks. For deaths, there has been an overall 8% average decrease in the new deaths reported during these 4 weeks in Africa. By country, the following is a breakdown by the most populous country in Africa. Ethiopia, 150% average increase. South Africa, 10% decrease, while Egypt, Nigeria, and Kenya, there is no change in that analysis. In terms of testing, we see that to date, over 110 million COVID tests have been conducted in Africa Union member states since the pandemic started. Over 366,779 new tests were reported for the epidemiological week 24. This is a 17% decrease from the previous week, which reported 443,000 new tests. The cumulative positivity rate is 11%, and the cumulative test per case ratio is 9.4. For this AP week 24, the positivity rate is 9%, and the test per case ratio is 11, which is an increase by 43% in the positivity rate from the previous week, and a decrease by 30% in the test per case ratio compared to the previous week. 5 countries, which represents 9% of the Africa Union member states, are reporting a positivity rate higher than 12% this week, and these are Cabo Verde, Ethiopia, Ghana, Morocco, and Tunisia. Let's look at COVID-19 vaccine updates on the continent. As of today, a total of 833 million doses of COVID-19 vaccines have been supplied to the continent, and 595 million of these doses have been administered, which gives us a 71% administration rate of the COVID-19 vaccines that have been made available to the African continent. However, the average coverage of by population is still at 17.7%, relatively far from the 70% target that we have set for ourselves. The following 10 Africa Union member states have vaccinated more than 35% of their populations: Seychelles at 81.1, Mauritius at 76.5, Rwanda at 63.1, Morocco at 61.7, Botswana at 61.5, Cabo Verde at 54.7, Tunisia at 52.8, Mozambique at 43.6, Sao Tome and Principe at 41%, and Lesotho at 38.6%. It is instructive to note here that 37 countries on the continent are actually offering booster doses in various age groups as defined by the local country level protocols. 3 African countries, Tunisia, South Africa, and Seychelles, are offering a second booster dose for people above 50 years, and they're using the Pfizer vaccine. Let me add here that in terms of delivery of vaccines, as we have said, we have over 833 million doses that have been supplied on the continent. Of these, the AVAT mechanism has delivered 57,447,000 doses, particularly those of Johnson & Johnson. These have been delivered to 35 countries on the continent and are divided into 3 sources. The Africa Union member states themselves have bought 33.3 million doses. Then the Saving Lives and Livelihoods program, supported by the MasterCard Foundation, has procured 17.8 million doses, and the US government donations that have come through the AVAT mechanism stand at 6.2 million doses. Delivery to countries of these Johnson & Johnson vaccines through the AVAT mechanism continues, and we expect that the speed will pick up as we roll out the Saving Lives and Livelihoods campaign. Let's move to monkeypox and the situation on the continent. During this pandemic period, a lot has been said about monkeypox, but it bears repeating that on the continent, the first human case of monkeypox was documented in 1970 in the DRC, and we currently have 10 of our Africa Union member states that are endemic for the monkeypox virus. And since the beginning of this year, 2022, we have documented 1,642 new cases, 1,571 being suspected, and 71 of those being confirmed. We have also documented 73 deaths, which gives us a case fatality rate of 4.4% here in Africa as a result of monkeypox in humans. These cases have been reported in 8 of our member states, 7 being endemic and 1, Morocco, being non-endemic. The countries are Cameroon, with 25 suspected cases, 4 confirmed and 2 deaths. The Central African Republic, 17 suspected, 8 confirmed and 2 deaths. Congo Republic, that is Congo Brazzaville, 5 suspected, 2 confirmed and 3 deaths. The DRC, with 1,346 suspected cases, 10 confirmed and 64 deaths. Liberia, with 7 suspected cases, none confirmed and no deaths. Nigeria, with 162 suspected cases, 41 confirmed with 1 death. Sierra Leone, 2 suspected, none confirmed and no deaths. Ghana, 7 suspected, 5 confirmed and no deaths. While Morocco has none suspected, 1 confirmed and no deaths. During this AP week 24, a total of 88 new cases with 5 confirmed and 83 suspected, including 6 new deaths have been reported. in 2 countries, and that is the DRC and Nigeria. And this gives us a case fatality rate during this week alone of 6.8%. In the DRC, since the last brief, there is a 38% increase in the number of new cases, of new suspected cases compared to the last report that we had. And cumulatively, DRC has documented 1,356 cases and 64 deaths, which gives a case fatality rate in the DRC of 4.7%. In Nigeria, since the last briefing, we have documented 26 new cases, 21 suspected and 5 confirmed, and no new deaths have been reported during this week. These figures represent a 12% increase in the number of confirmed cases compared to the previous report. And cumulatively, Nigeria has now reported 203 cases and 1 death, giving a case fatality rate of 0.5%. In terms of response, we are supporting our countries to strengthen surveillance, isolate those who have been identified to have the virus, and manage them appropriately in the special areas for caring for monkeypox patients. We are monitoring very closely what is going on across the continent, including through our regional offices. Let me also add here that we are not only dealing with the COVID and monkeypox on the continent, we are also having cholera being reported in Kenya, Cameroon, the DRC, Malawi, Mozambique, and South Sudan. Influenza H3N2 has been reported in Ghana, vaccine-derived polio in Burkina Faso and Chad, Lassa fever in Guinea, Liberia, Mali, Nigeria, Sierra Leone, South Africa, and Togo, measles in Cameroon, Liberia, Mali, and Namibia, while yellow fever has been reported in Kenya, with anthrax in Uganda. In as far as the animal population is concerned, we are reporting H5N1 virus in Burkina Faso, Cameroon, Cote d'Ivoire, Gabon, Ghana, Guinea, Mali, Namibia, Niger, Nigeria, Senegal, Togo, and South Africa. And Uganda is also reporting anthrax in the animal population. This is a pointer to the fact that although we are still in the middle of the COVID-19 pandemic, although monkeypox is now raising even more health security concerns, we still have other outbreaks that we have to provide support to our member states with. Indeed, it forms part of our emergency operations here on the continent. Apart from the health emergencies that we are seeing on the continent, we also have other important items that I would like you to note. As we discussed last week, our health ministers did meet on Tuesday, as had been planned, and they, after some debate and some guidance, they did pass Africa CDC's amendments to the statute and have therefore passed that on to our ministers of justice and legal affairs, who are going to be meeting later on next week. So at least the first step has been achieved with the health ministers passing the statute as amended of the Africa CDC. I'm also just from the Republic of Korea, where we held very fruitful discussion with the government and the private sector there relating to expanding partnership in building the capacity of the African continent when it comes to particularly diagnostics and vaccines. And in the coming months, I will be giving more detail with the capacity building activities beginning. Indeed, we expect that we may get some private sector from South Korea to establish their facilities here on the continent. So that was also a very productive mission to the Republic of Korea. Also during this week, we have kicked off actively the Saving Lives and Livelihoods program, where our country level partners, we call them level 2 partners, were at a workshop here in Addis Ababa to begin the process of supporting countries to do mass vaccination for COVID-19. Indeed, there was an opportunity for the different organizations to know each other. There was an opportunity to share lessons learned, and then there was also an opportunity to align on the next steps. In fact, for the SLL program, we initiated the first country to be Ethiopia last week, and we expect that many more countries are going to have their mass vaccination campaigns initiated in the coming days. We also, in collaboration with the Robert Koch Institute of Germany, in short RKI, the International Institute for Infectious Diseases and the Southern Africa Development Community SADC, we came together and last week organized a workshop where we were building the capacity of countries in the Southern Africa region for epidemic intelligence using the One Health approach. We are very keen to ensure that we are working closely under the One Health approach with our colleagues from the animal sector and the environment sector as well. And in the coming days, we will be updating you more as we expand our work with that part of our expert panels using the One Health approach. These are the items I wanted to share with you today, and I'll be happy to take any questions. Back to you, Away.
Thank you very much. That was Dr. Ahmed Ogwell, who is the acting director of the Africa CDC, giving us a very comprehensive rundown of some of the public health challenges that our continent is having to grapple with at this moment, and also some of the interventions that are being done by the Africa CDC to make sure that we continue to safeguard the health of this continent. As he mentioned, it is now time for us to move on to our question and answer section. Let me just give you the WhatsApp number if you have any questions that you want to send through. It is +251 94 550 2310. But we can also talk to you live as well as take your questions on the question and answer section. Let's kick off our Q&A with a question from Judith Akolo, who is with the Kenya Broadcasting Corporation in Nairobi. My question to Dr. Ahmed is, can we in Kenya safely say that we are now in the 6th wave of COVID-19?
Correct, Judith. The indications in as far as numbers are concerned, our analysis over the last 4 weeks gives us the picture that Kenya is now moving into its 6th wave.
Thank you for that confirmation. Dorcas Wangira, who is with the BBC Africa, she says, the G7 countries pledged 1 billion COVID-19 doses to poor countries as a big step towards vaccinating the world. As it is, only 17.7% of Africa's population has been fully vaccinated. Only 833.5 million doses of COVID-19 vaccines have been received. So what is Africa's CDC's rallying cry to the G7 ahead of this year's summit that kicks off on Sunday?
Thank you, Dorcas. For the G7, we have three messages. One is that the priority for the African continent in the next couple of months is vaccination. We need for all vaccines that we have received to be in people's arms. So that is the first priority. Second, the message that we have for the G7 is the promises that have been made. We are looking forward to those being concluded in a timely manner, where timely is the doses of vaccines should come at the time that we need them. Not too early so they expire, but not too late so that we don't get them into people's arms. So the promised doses, it is very important that they come. The third message that we have for the G7 is that Africa needs support to be able to take care of its health security. In this way, the secured health security of the continent of Africa will be the secured health security of the whole globe. So these are the three messages that we are sending to the G7 as the summit opens up. And we are quite hopeful that all three are going to receive the appropriate feedback back from the G7 meeting.
Okay, thank you very much for that. Good morning or good afternoon to James Macharia Chege, who is with Reuters in Johannesburg. He says the World Health Organization will today decide whether to declare monkeypox a global health emergency. This has drawn criticism from leading African scientists who say that it has been a crisis in their region for years. What are your views about this pending decision? And is it a global health emergency according to the Africa CDC?
Thank you, James. Only WHO is vested with the authority to declare a public health emergency of international concern, what you're referring to as a global health emergency. And therefore, as Africa CDC, we'll wait for the pronouncement from WHO after the meeting that is scheduled to begin shortly. In as far as the situation of monkeypox here on the continent is concerned, indeed, from the beginning of the pandemic, as the numbers grew, monkeypox was a very big concern to us here at Africa CDC. Indeed, looking at the numbers, over 10,000 since the beginning of the pandemic, over 1,600 just in the first 6 months of this year, case fatality rates that are ranging anything from 4.4 to 4.7 is the kind of situation where you need emergency response. And for Africa, monkeypox has been an emergency from the beginning of this pandemic because the numbers rapidly grew, and it is a situation which will have benefited from the release of emergency support, including vaccines that will have helped in protecting our frontline workers, as well as those near to the individuals who had been diagnosed to have monkeypox. So here on the continent, the numbers that we have seen is in emergency levels, but globally, we wait for WHO to make that pronouncement. But as I said last time, all countermeasures, including vaccines, need to begin here on the continent because our numbers and case fatality rates are higher than the rest of the world.
Thank you very much for that. We come back to Judith, who has a second and third question. So her second question, she says, what should we say is the prevalent variant that is being experienced in Kenya? Let me also give you her third question. She says there has been talk of a mutation having happened and that most Kenyans might be infected with another variant of the coronavirus that is not being picked up by tests that are being undertaken. Is this true, and what is your advice?
No, thank you, Judith. First is to say that we have not picked any new variant of COVID-19 anywhere on the continent. Indeed, there's been no reports from elsewhere in the world. So no new variant has been documented. All variants of COVID-19 can be picked with the current laboratory testing that is available, and we have not seen any testing difficulties with the variants that we currently have on the continent, indeed globally. So the escape mechanism for testing for COVID-19, we have not seen any variant like that. And I would really urge the Kenyan situation to follow evidence and avoid the rumors that are circulating so that it does not cause unnecessary panic. There is no new variant that has been documented, and there is no COVID-19 virus that is escaping testing using the regular methods that we will use from the beginning. Thank you.
All right, thank you. Follow-up question from Dorcas Wangira. She says the World Health Organization is set to make two major announcements on monkeypox. One is to rename the virus, and two is whether to declare it a public health emergency of international concern. She asks, has the Africa CDC had any input in this? I know that you took this a similar question earlier, but perhaps that angle of the Africa CDC having an input, perhaps you just need to emphasize that again. And then she also asks, has a confirmed monkeypox case been had in any other non-endemic country in Africa besides Morocco?
Thank you, Dorcas. The second question is no, we have not documented any other case in a non-endemic country on the continent. In as far as the renaming of monkeypox is concerned, we have made our inputs to the WHO process, and we are looking forward to this being released in the coming days. In as far as the public health emergency of international concern goes, indeed, yes, Africa CDC, we have made our inputs on what we think the situation is, and so we are waiting for WHO to make that pronouncement as well.
Okay, thank you very much. We have two final points of clarification that we have from Dorcas and Judith, but I see that we have other colleagues who are listening to us online, and I'd just like to remind them that these are the final two questions that we're dealing with. So if colleagues, you have any further questions, please indicate your desire to ask them so that we can then make for that time. All right, so Dorcas and Judith have 2 points of clarification. Dorcas wants you to clarify if you mentioned that the outbreaks in Burkina Faso and Chad is vaccine-derived polio. And she notes that you said it is vaccine-derived COVID. Then Judith Akolo says, kindly just for further clarification, what is the current variant in circulation in Kenya?
No, thank you. Dorcas, Burkina Faso and Chad, it is vaccine-derived polio, not COVID. It is vaccine-derived polio. For Judith, which is the variant that is actively circulating in Kenya, this will be a question for the Kenyan authorities to be able to provide, because the figures that we collect is for new variants, but the ongoing surveillance of which variants are actually prevalent in a country, this we leave to the country authorities to be able to do and to provide such information. We are focused more on any new variants that may be coming into place rather than surveillance, the continued surveillance on a country-by-country basis. Thank you.
Okay, thank you. James Macharia Chege with Reuters in Johannesburg. South Africa has repealed COVID-19 restrictions on mask wearing in indoor public spaces, limits on gatherings and entry requirements at its borders. What is your comment on these new measures, especially considering that the country has recorded the most COVID-19 cases and deaths on the African continent?
Thank you, James, for that question. For country-level protocols, the governments of each and every country will review their situation and using data from within the country, including the border points, they then make a determination what protocol they will be able to follow based on the broad range of advice that we give as Africa CDC. In general, when numbers are going up, it is important that we maintain COVID-19 protocols, including the wearing of masks, sanitizing, and distancing. We need to also increase our surveillance, particularly in our health facilities and our border points, so that we can be able to pick any outbreak or any hotspot that is happening within a country. So we encourage countries to use their data carefully so that they are able to provide guidance to their citizens and their visitors as appropriate to the evolving circulation of COVID virus within each and every country. Because we have such a broad range of situations on the continent, the level of circulation, the level of vaccination, the capacity of the country, we also expect that the protocols will not all be the same during this stage of the pandemic, and we will find always some differences from country to country. But each country, we have encouraged them to use their own data, the evolving situation on the ground, and their capacity for surveillance to be able to provide any adjustments and amendments to their protocols for COVID-19. But in general, we encourage that we continue to wear our masks, we continue to sanitize and wash our hands, we continue to have appropriate distancing when it comes particularly to places where many of us are going to be congregating in the same locality. So this is the advice we give, but appreciating that each and every country will have different evidence and the evolution of the pandemic.
Thank you very much. I think we've gone through all our questions. I'm looking at all our platforms and I don't see any further questions coming to us. So perhaps this is the time for you to give us a roundup of the main points that you would like colleagues who are online to take away from the briefing today.
Thank you, Wayne. And I have four messages today. The first is that COVID is still with us. The numbers are suggesting that we may see another wave. So COVID is still with us. Let us not suggest to ourselves that it has gone. COVID is still here. Second is that our Saving Lives and Livelihoods program has kicked off here in Ethiopia last week, and we are rolling out into more and more countries, and we expect that this will have a very significant impact on the vaccination rates on the continent. Indeed, when this is combined with the Bingo initiative, we expect that the participation of the youth in vaccination campaigns is going to increase the overall vaccination rate on the continent. The third message I have today is that monkeypox is spreading on the continent. And we are seeing the numbers are increasing, and we are also seeing that the number of countries with suspected cases have also been increasing over time. For this, we are calling upon our member states to have good surveillance mechanisms in place. Africa CDC is providing capacity building for laboratories to be able to do diagnosis here on the continent. And we are also providing capacity building for our clinical staff so that they have a higher index of suspicion for cases that may be monkeypox. So in this way, we will contain it and not see it spreading elsewhere. And tied to monkeypox, apart from the new name coming through, we would like that the stockpiled vaccines be released to African countries that have high numbers and are at high risk, so that we can be able to vaccinate our frontline workers and those within affected communities. And finally is to say that we as Africa CDC are very pleased with the decision that was taken by the health ministers on Tuesday in as far as the amendments to the Statute of Africa CDC is concerned, and the journey for an autonomous Africa CDC has taken momentum, and we are looking forward to the Justice Ministers doing the same, and eventually the Executive Council acting on behalf of the Africa Union Assembly, eventually passing the amended statute of the Africa CDC. And I thank all the journalists who made time to be with us here today. Thank you also, Wayne, for excellent motivation, and we are looking forward to next week's briefing. I thank you.
Thank you very much. That was Dr. Ahmed Ogwell, and he is the Acting Director of the Africa Centers for Disease Control and Prevention. Thank you again, colleagues, for having joined us for the past 45 or so minutes, and for the continued interest that you have to continue tracking these pandemics that we have on the continent and providing that life-saving information to the publics across this great continent of ours. We'll meet again on Thursday next week at the same time. For now, bye-bye.